Welcome to your online mental health awareness training, presented by Oneida Herkimer Madison BOCES Safety Office. Resources are inclusive. Schools can and should go beyond providing classroom instruction on mental health and focus efforts on developing a positive school climate and culture. For more information, please contact someone at your district, visit our website, or reach out to the Oneida County Office of Mental Health. The New York State Education Department amended the Commissioner's Regulations for Health Education, Part 135, to introduce a mental health component in the health curriculum in New York State schools. This law was signed by Governor Cuomo and took effect in July 2018. New York State is the first state in the nation to require that health education include mental health and the relation to physical health, enhance a student's understanding, attitudes, and behaviors that promote health, well-being, and human dignity. The mission of New York's school mental health program is to break down barriers to learning so the general well-being of students, families, and school staff can be enhanced in collaboration with other comprehensive student support and services. According to the World Health Organization, mental health is defined as a state of well-being where every individual realizes their own potential, can cope with normal stresses of life, can work productively, and can make a contribution to their community. Mental health can be seen as a continuum ranging from having good mental health to having a mental disorder. Everyone may fall on this continuum at different points of their lives. It is estimated that 18.5%, or over 43 million people ages 18 and older, can suffer from a mental disorder in any 1 year. This equates loosely to 1 in 5 adults. 22% of youth ages 13 to 18 experience some form of mental disorder. That is about 1 in 5 students in our schools. And 60% of high school students with mental illness do not graduate. Although 14 is the average age of onset of a mental health issue, most people do not seek assistance until adulthood. Mental health challenges are more common than heart disease, lung disease, and cancer combined.
Mental health conditions are more common than you may think. 1 in 5 youth or young adults lives with a mental health condition. Do you know the warning signs? Like feeling sad or withdrawn for more than 2 weeks. Severe mood swings that cause problems in relationships. Intense worries or fears that get in the way of daily activities. Sudden overwhelming fear for no reason. Or seriously trying to harm or kill oneself, or making plans to do so. Not eating, throwing up, or using laxatives to lose weight. Significant weight loss or weight gain. Severe, out-of-control risk-taking behavior that can cause harm to self or others. Repeated use of drugs or alcohol. Drastic changes in behavior, personality, or sleeping habits. Or extreme difficulty concentrating or staying still. If you see these signs in yourself or a friend, tell a trusted adult. The first step to getting help is to say it out loud.
Mental health wellness includes our self-esteem and self-confidence, identifying and expressing and regulating our emotions, setting and achieving goals, recognizing our creative skills, and our ability to empathize with others. In general, mental health wellness and well-being is dependent upon good health, social relationships, and availability and access to basic resources. As a child, these can also include a sense of security and safety, as well as an environment of inclusion. Having supportive relationships is one of the strongest predictors of well-being. Mental health and mental disorders are oftentimes used synonymously, but they are different. Mental health is a broader feel on a daily basis. Mental health is not like an on-off switch. There are different degrees of health, with people ranging from great health to poor health. Many people fall somewhere in the middle. They are generally in good health with an occasional problem that may surface. Mental disorders can include depression, anxiety, bipolar disorder, or schizophrenia. Mental illness is a diagnosable illness that influences a person's thinking, behaviors, or feelings. According to the Mental Health Association in New York State, half of all chronic mental illnesses begin by age 14. Half of all lifetime cases of anxiety disorders begin as early as age 8. Early signs of mental illness are often mistaken for typical characteristics of childhood and adolescent development. 22% of youth experience serious mental illness in a given year. An estimated 50% of all Americans are diagnosed with a mental health disorder at some point in their lives. Oftentimes, early signs of mental illness are mistaken for typical characteristics of childhood and adolescent development. Youth may self-medicate in order to cope with the symptoms of an undiagnosed mental illness. Early recognition and intervention is crucial. Effects of an untreated mental illness include students being unable to complete high school, go to college, trade schools, or even obtain employment. These students are 3 times more likely to be involved in criminal activities. According to the CDC, suicide is the 3rd leading cause of death among 10 to 24-year-olds in the United States, with about 13 lives lost every day and 4,600 lives lost each year. When adding up the losses of life and human potential, we see the incredibly high cost of not acting early and assisting our youth. If only. If only is a phrase that is heard all too often. If only we knew what was going on. If only I could have helped. There are many opportunities to support the mental health of young people. As a school community, we should focus on promoting mental wellness, preventing mental health problems, and providing a treatment response. It is the little things that can help students get excited for life. With prevention and early intervention, we can have a positive impact on our youth. An intervention strategy can be as simple as asking a student, "How are you doing? Is everything okay? And what's wrong?" It helps to understand the degree of disability that mental disorders can cause by comparing them to physical illnesses. Mental health issues can have lasting effects throughout a person's life. Experts rate mental disorders as the most debilitating illnesses. And due to the fact that they may not be visible, people who suffer from mental illness issues may be viewed in a negative light. Mental, behavioral, and neurological disorders are the leading cause of disability in the United States, followed by cardiovascular and circulatory disease. Moderate depression is comparable to symptoms of severe asthma, a constant state of exhaustion and fatigue, as well as body aches and pain. Severe depression is comparable to the disability of quadriplegia. Oftentimes, the stigma and discrimination of a mental illness prevent people from seeking mental health care. Only about 40% of those with a mental illness seek treatment, and half of those who seek treatment wait an average of 10 years from the time they begin experiencing symptoms. Much of the stigma and discrimination regarding mental health care is based upon common misconceptions rather than fact, according to the World Health Organization. These misconceptions include: physical problems are worse than mental health problems. You can't recover from a mental illness. Mental health issues are rare. Mental health issues are a sign of weakness, and you can't do anything for a person with mental health issues or illness. Adverse childhood experiences are traumatic events occurring before age 18. Adverse childhood experiences are likely to affect one's physical and mental health. The more risk factors that adolescents are exposed to, the greater the potential impact on their mental health. These traumas can include the death or loss of a loved one, being in foster care or having an incarcerated parent, witnessing domestic violence, bullying, abandonment, neglect, or betrayal of trust, experiencing a natural disaster, abuse, and divorce. According to the National Suicide Prevention Lifeline, some warning signs may help you to identify if a person is at risk for suicide, especially if the behavior is new, has increased, or seems related to a painful event, loss, or change. If you or someone you know exhibits any of these signs, you should seek help. The National Suicide Prevention Lifeline is just a phone call away. The number is 1-800-273-8255. Warning signs of self-harm can include wanting to die or looking for a way to kill themselves, feelings of hopelessness with no reason to live, feeling trapped or in unbearable pain, talking about being a burden to others, increasing the use of alcohol or drugs, acting anxious or agitated, behaving recklessly, sleeping too little or too much, withdrawing or isolating themselves, showing rage or talking about seeking revenge, having extreme mood swings. Some ways to respond effectively to a person can include being a good listener, being responsive with a caring approach, and paraphrasing what the person is saying to show that you understand what they are telling you. Being non-judgmental about circumstances that are shared. Speaking at a level appropriate to their age and development level. Remember that mental illness has nothing to do with a person's intelligence. Use encouragement in words that heal and not hurt. Maintain confidentiality unless safety is at risk. And be the example. Serve as a model of honesty and dignity. If you have questions or concerns about a student's behavior, Some resources that you can go to are teachers, principals, school psychiatrist or psychologist, a school social worker, and other mental health professionals. Your job isn't to figure out what the problem is, it's simply to get the individual help. In the words of Christopher Robin from Winnie the Pooh, promise me you'll always remember you're braver than you believe, stronger than you seem, and smarter than you think. This concludes the required mental health training. Thank you.